This presentation reviews the ADEA Academic Dental Careers Fellowship Program, also known as the ADEA ADCFP. The purpose of this presentation is to give you a general understanding of the program and to perhaps spark your interest. The purpose of the ADCFP is to connect dental student fellows with a faculty mentor in order to provide students insight into the day-to-day life of a faculty educator or researcher. It is a voluntary program offered by ADEA and managed by each individual oral health institution. ADEA's goal is for every institution to offer the program, and to that end, it is intentionally flexible by design in order to meet the goals and needs of individual participants. Since its inception in 2006, more than 1,000 students at 47 dental schools have completed the ADCFP. Objectives: to provide an opportunity to explore career pathways within academia, to provide professional training specific to teaching and research, to expand peer and professional networks, to enhance engagement between students and faculty, and to provide mentoring and faculty development experiences for faculty. For faculty and institutions, this program seeks to increase institutional capacity to develop the pipeline of students interested in academia and to support faculty efforts to foster a collaborative culture of teaching and research excellence. This slide reviews the institution participant roles and how they interact to meet the program objectives. Each institution elects a coordinator or liaison. Some schools elect 2 liaisons. Each institution recruits faculty and student mentor pairs to begin the program in May of each year. Schools have had anywhere from 1 to 23 faculty-student mentor pairs. In a collaborative effort, the ADCFP liaison and faculty mentors provide a positive and engaging experience for student fellows while simultaneously creating a hub for all students interested in pursuing academic careers. Let's look a little bit more closely at the program participants that we have mentioned thus far. The role of the ADCFP liaison is to serve as the primary contact with ADEA, convey issues that arise or programming that would be beneficial, as well as to serve as the ambassador of the program objectives to institutional members. The liaison is not a manager of the faculty-student mentorships. The detailed interactions between the faculty mentors and student fellows is the responsibility of those individuals. To ensure that communications from ADEA reach the faculty mentors and students as appropriate, ADEA will send informational PowerPoints and other items of interest to the ADCFP liaisons, who should forward this on to faculty mentors and students. ADEA will request information from liaisons about program participants at each institution. Faculty mentors work directly with the student fellows. They co-create the action plan with the fellow. They meet with the fellow at least twice a month, ideally in person. They provide the fellow with mentorship and logistical assistance with teaching and/or research projects. Faculty mentors manage the fellows' progress in the program and provide feedback on their work. Faculty mentors might be individuals who exclusively teach a lecture-based didactic or clinical course, or they might be exclusively involved in clinical instruction. Faculty mentors may also be involved in conducting clinical, educational, or biomedical research, or they could put the student in touch with a faculty member who could support that aspect of their program. Let's talk about the student fellows. At most institutions, ADCFP's student activity is generally from May until December. The student works on their final project until they submit their poster information for the ADEA annual session and exhibition, which takes place in March. Some institutions might align their ADCFP program with their specific academic year or calendar. The ADCFP is flexible and customizable to meet the needs of the institutions and student fellows. Who is eligible? Any student in predoctoral dental education, allied dental education, or advanced dental education who is interested in learning about academic careers, such as teaching or research. Usually, the student fellow identifies their research interest as teaching track, either educational or clinical research, or a student may select a biomedical or basic science research track. The liaison may utilize the ADEA sample application, or they may create their own application for interested students to apply to participate in this program. ADEA applications can be used to collect information about the students, or it can be used in a competitive manner to rate applicants and determine entry into the program. Each school takes a different approach to this process. In whatever format, schools are strongly encouraged to have some sort of an application process. On this slide, you can see some of the program components that have been utilized by ADCFP programs at oral health institutions around the country. The fellow and faculty mentor pairs design their own unique experience utilizing these program components. They are welcome to choose any of these components or design their own. ADEA recommends that at a minimum, each student fellow meets with their faculty mentor twice monthly, and that they complete their action plan early in the course of the program, most often by May, to ensure that the goals and outcomes are clearly defined at the start of the program. ADEA recommends the inclusion of reflection papers as a component of the program, and that each student completes a scholarly research project. Each of these will be reviewed. However, the faculty mentor and students can design their own program utilizing some or all of these plan. This plan is a brief description of the final research project, a preliminary timeline to complete the project, as well as the other professional and personal goals the fellow plans to achieve. The fellow faculty mentor pairs have latitude in designing their own program to meet their goals. Here you can see an example of what should be included in an action plan. Typically, they include the fellow's personal objectives for the year, the schedule of the mentor faculty bi-monthly meetings, due dates for the first career reflection essay, roster of faculty to be interviewed, list of fellows' teaching assignments, research project description, and other activities planned to achieve objectives. Action plans are usually due in May or June or early in the program cycle. Usually, the fellow identifies 2 or 3 objectives that address questions such as, what will be the experiences that will define the program? What are my personal goals? How will the goals be measured? The objectives might center around the teaching activities or a biomedical research project. Some examples of a teaching activity might be to develop a syllabus, course objectives, a lecture, or a lunch and learn for students, or they might develop an assessment tool. Research practicum examples might include designing a new project or work on an existing faculty project that their faculty mentor is already working on, or a lunch and learn for students. A frequently asked question is, can students have more than one faculty mentor to help them achieve their goals? And the answer is yes. Bi-monthly meetings. This is the most critical aspect of the program. No matter how busy both the student and faculty may be, meetings should not be cancelled. They may occasionally be rescheduled, shortened, but not cancelled. Meetings should occur at a minimum twice a month. The meeting should be scheduled for at least 30 minutes, and fellows should prepare questions prior to the meeting. These meetings are extremely important. Reflection essays. ADEA recommends that fellows complete at least 2 career reflection essays, one early in the program when the action plan is developed, and a second with the final portfolio. However, the student-faculty pair may decide on more if appropriate. The first essay might have the student fellow reflect on why they are interested in an academic career, or have them identify priorities for the professional component of their life. For example, what are your career goals? And where does academia or research fit in? And it could also have them articulate the values, preferences, and principles that guide their concept of being an educator. In the second essay, they can describe their impressions of what it is like to be a dental school faculty member, identify the motivations and challenges they associate with choosing an academic career, and include reflection on how their thoughts about a career in academia have evolved during participation in the program. Many students conduct interviews with faculty other than their mentor. This could be a faculty member or administrator, a new junior faculty or senior tenured professor, an individual focused on research, or an administrator, for example, a dean, associate dean, or director. On the screen is a sample list of individuals who might be interviewed by the student. And to ensure that students are well prepared for interviews, this slide shares sample interview questions, and the faculty mentor can play an important role by reviewing the interview questions with the fellow. ADEA also recommends these guidelines for interviews. Fellows should have a list of questions prepared before the interview. Each faculty interview should be a maximum of 45 minutes long, and the student should draft a synopsis of each faculty interview. After all of the interviews are completed, fellows should write a reflective paper on the overall impression and themes they identified. Samples are available on our website. Some students may choose a teaching track. ADEA recommends that the student selecting the teaching track has at least one teaching experience per semester. This can occur in a variety of settings, such as a standard lecture in a didactic course, several experiences teaching in a preclinical lab, developing and delivering a small group case conference or seminar experience, and for a senior level student, there might be an opportunity for participation in a clinical setting to gain exposure to teaching in that session. How that might look for the fellow and the mentor. The fellow might develop objectives, a presentation, and handouts after receiving guidance from the mentor on topic selection. The student fellow will review objectives and the presentation with their mentor and schedule a rehearsal with their mentor. The mentor can assist the student by making appropriate arrangements, guiding the rehearsal, and observing the classroom presentation. The fellow should also develop an assessment tool for participants and for themselves. The mentor should provide feedback and complete the assessment. Biomedical research track. For students interested in a biomedical research project, and therefore a research track, they should follow a standard description of a research project and include the focus and title of the research project, a synopsis of the project, rationale, study design, methodology, data collection and analysis, the research question or questions and hypothesis. The specific student roles and responsibilities in the project should be clearly stated so that there are no misunderstandings, especially if the faculty member overseeing the project is not the primary faculty mentor. And of course, the proposal will include the name or names of the faculty members, who will supervise the student in the biomedical research project. Many faculty mentors and liaisons develop other activities for the student fellows. These are typically based on the desired outcomes of the student fellows. These are some examples. This is not exhaustive, but it should give you an idea of what some schools have offered fellows by way of observing activities and meetings that faculty regularly participate in. A reflection component should be a part of each of these observation activities, in addition to the two main reflection papers that were reviewed earlier. Activities can support network building in informal settings. Here you can see examples of what form these might take. Early on, the mentor can facilitate this, and then later on, the student can take the lead. ADEA recommends that before each student fellow completes the ADCFP, that they prepare and present a poster presentation. Students who complete the ADCFP program have the option of presenting their poster at the ADEA annual session. However, this is not a requirement for the completion of the fellowship program. Schools are strongly encouraged to arrange a poster presentation at their home institution in an effort to share with other faculty and students the fruits of their hard work, and as an important way to excite others to participate in the ADCFP program the following year. Additionally, at the ADEA annual session, there is an ADCFP reception where fellows receive their certificate of completion and get the opportunity to network with ADCFP fellows and mentors from other institutions. Don't worry if you cannot attend. The certificates will be mailed for those who do not attend. The fellowship culminates with the student fellows putting together their final portfolio. The portfolios should document all of the activities that the fellow took part in during their fellowship year, from plans and meeting logs to reflections and assessments, reports, research, and, if applicable, the poster created for the ADEA annual session or presentation at their home institution. Thank you for listening to this recording. If you have questions, please send us an email. Our email address is on the website.